You've probably noticed a global push for AI as it pops up in political speeches, newspapers, and even staff meetings. And in some ways, AI is nothing new. We have existing frameworks like law for data and medical product development that will guide a lot of healthcare AI products in the same way they guide other healthcare products. But some things are different, and that is concerning. In many countries and in many sectors, we have had a big push for AI. That is concerning because it assumes the regulatory environment is ready to keep AI safe. But that probably isn't the case. For example, automation bias is a well-known risk in AI. It is often discussed in the research that when humans use AI, they can start to mentally switch off. It's like when you have a new employee. At first, you check their work and make sure they are on track. And after they produce good work, your mental energy gets diverted elsewhere. And this is worrying when you consider another issue discussed in the research: AI drift. AI drift is when the AI's outputs change over time. Often human oversight is how organisations plan to mitigate the risk of drift. But that becomes a challenge if the person has switched off. That is why we joined the MHRA AI Airlock. The Airlock is a regulatory sandbox, which basically means it's an environment to explore challenging regulatory questions safely. And our question was, is real-time monitoring of AI output, clinician agreement, and data quality important to keep healthcare AI products safe? We made this question very granular by asking 4 smaller questions. Do any existing trends in the use of AI indicate risk? For example, how often a user agrees with the AI's outputs? Can these trends be reliably presented in a real-time monitoring dashboard? Is there a place in current regulation and day-to-day healthcare practice for such a dashboard? Is there a way to address these risks once they've been identified? Answering these questions had to be both systematic and grounded. Systematic, so we can trust what we learn, but grounded, so what we learn is useful to our healthcare system. So we approached it with 3 work packages: an academic study to check if trends exist and be reliably presented. We will discuss their work in greater detail in another video. However, spoiler, they do, and we can. A meticulous gap analysis of the relevant law and related guidance to see if there are gaps and changes that need to be made. A roundtable discussion with leaders from hospitals, regulators, industry and academia to discuss what happens in practice and if real-time monitoring would be useful. So here are the 5 key lessons we gained. Firstly, the idea that you should be looking at data quality, human-AI agreement, and AI output is not new to the regulatory ecosystem. A guidance document published in 2023 discusses looking at these when managing the risks of AI. It is a known problem. Secondly, despite knowledge that over-reliance on AI or automation bias is an issue, our current detection of it is not very good. It seems few organisations check for it, and when the check happens, it's not very thorough. There seems to be 2 key factors in this. First is that although guidance states it should be considered, it is not clear how to go about this. This is partly expected because guidance is quite broad to allow it to be widely applicable. However, this breadth also leaves the creators and users of AI in a difficult position because of the second factor. The second factor is that properly tracking automation bias is often impossible because the infrastructure is not there to do it. The third finding was that trends, well, they're tricky. There is a more thorough requirement to report trends coming in the UK regulation this year. But what counts as a trend? A 2% change in performance? A 5% change? And beyond that, what action do you take and when? What level of change triggers an internal investigation? When do you tell the regulator? The fourth finding was an interesting one. During one exercise, we asked one group of people to pretend to be a manufacturer of AI, and another group of people to be the hospital using their AI. We then told them something had gone wrong with their AI, and asked them who was responsible for dealing with it. What was interesting was that the 2 groups turned on each other. Instead of following a clear protocol of analysing and sharing information, they protected their fictional organisations. You see something like this in practice a lot, communication breaking down whilst each organisation fights its own fire. We need a better framework for collaboration. This is a deceptively simple task that raises some challenging topics, such as the economic value of a failing product or an improved product, the appropriate and expected use of data, and whether existing skill sets can address the issues AI present. This is something we're looking at now. The final lesson was that the overarching issue of keeping AI products safe in healthcare is a global challenge the UK is in a pretty good place to step up and fill in some of the gaps in guidance and practice. That is thanks to the structure of the National Health Service, the local expertise, and programmes like Airlock. I personally will keep working on the challenges raised in this video, and I'd love to hear from you if you care about this too. I hope for the sake of patients and healthcare staff, we take up this challenge nationally, and we share what we learn with the rest of the world.